Earlier this month, VMS President-elect Dr. Trey Dobson from Bennington and I went to Washington, D.C. to meet with Vermont's congressional delegation, as well as learn more about the various healthcare-related initiatives going through Congress. With President Trump being in charge and the Republicans controlling both the House and Senate, there's a great deal of activity, much of which is of great concern to the VMS. The House Republican efforts to repeal the Affordable Care Act, as it's currently been drafted, will significantly reduce the number of Vermonters with insurance and put at risk some of the progress we've made. In addition, President Trump's budget would undermine many important social programs, environmental programs that help those most in need, the very young, the very old, and the disabled. I anticipate that the VMS will take a strong position against the proposed congressional action at its April 8th council meeting. This is a time when organizations such as the VMS really need to advocate on behalf of their patients and the citizens of our state.
Wanted to make sure that members were aware of a success we had this past couple weeks. We had our bill supported by the Vermont Medical Society, S45, pass the Senate and now enter the House Healthcare Committee. This is a bill that makes some minor modifications to Vermont's gift ban law. It would allow physicians and other clinicians, such as physician assistants and nurse practitioners, to accept modest meals at CME conferences as long as any content that you were listening to at the same time as you were eating was either accredited CME or otherwise free from industry influence. We've heard from a number of members that this is a barrier to obtaining CME credit, that many members who travel to National Specialty Society meetings may be prevented from entering sessions or asked not to eat food at sessions that have food sponsored by pharmaceutical companies during a lunch or other mealtime. So we are looking to make this modification to the gift ban bill, and as I mentioned, it's passed the Senate and is now in the House Healthcare Committee. We encourage any members who support this measure to contact members of the House Healthcare Committee and ask them to take up the bill and support it as well. The Vermont Medical Society is seeking input from our members about a bill H496 that would ask for regulation of medical assistants. These are individuals who can help in outpatient practices or other healthcare settings that are currently not licensed or regulated in any way. A physician or other clinician can delegate tasks to these individuals as they feel appropriate based on the individual's skill and training, and as the physician is able to supervise. So these are individuals who help with rooming, help with taking basic vital information from patients, getting a very basic description of why the patient is there that day. And there is a bill that is asking for these individuals to become regulated. It doesn't specify how they would be regulated. It could be something like specifying a scope of practice. It could be specifying education or other training requirements. And we are seeking feedback from our members about the pros and cons of such an approach, and ask that you contact me, Jessa Barnard, if you have feedback about this measure.
Last Friday, the Senate Health and Welfare Committee voted unanimously to support SEDA 8, which is a bill that will increase the smoking age from 18 to 21. We are watching the bill as it goes through the Senate. We think it might go to appropriations, but please contact your senators and let them know that you support this to promote the health of our young people and our adults.